Hello, everyone. It's so great to see all of you logging on. We're going to give folks a minute or two to join us, so we'll be starting soon. Good afternoon. It's so great to see so many of you logging on to join us today. I think we had over 12,000 people register for today's webinar, which we are really excited about. So it's great to see so many of you here for this very important topic. My name is Nicole Dubois, and I am a senior research analyst at the National Alliance to End Homelessness. I will be your moderator today for this webinar, which is the 8th in the Housing First webinar series, a joint production of the National Low Income Housing Coalition, the National Alliance to End Homelessness, and the Center on Budget and Policy Priorities to promote best practices like Housing First. Housing First recognizes the centrality of housing to addressing all our human needs and prioritizes obtaining permanent housing as a platform from which to pursue personal goals and improve the quality of life. At the core of Housing First is meeting people where they are and ensuring they have access to the services and supports they want and need. Decades of evidence shows that Housing First is the most effective way to access housing quickly and maintain stability in housing over time when paired with voluntary services and supports. The evidence also shows improvements to a person's health and well-being once they are housed. On a community level, researchers have documented how Housing First interventions decrease emergency room and other crisis services use. Because of these reductions, investments in Housing First programs can pay off, particularly if programs are serving people with high medical needs. Study after study has shown that Housing First promotes healthy people and thriving communities. If you've been tuning into these webinars, you've also heard about threats to the Housing First approach and what our country might look like if it was defunded or deprioritized. This is a critical moment in time to build on the progress that we've been making. Between 2017 and 2020, over 900,000 people on average exited homelessness each year. It's important not to lose sight of these successes. Homeless service providers across the country have been housing record numbers of people. But during that same time period, about 908,000 people entered homelessness each year. Our homelessness response systems are working, but we're faced with new influxes of people falling into homelessness because of our inadequate safety net and other structural forces at play. During the pandemic, the effort providers engaged in to keep people safe and provide housing was heroic and unprecedented in many ways. We are now standing at a precipice. The impact of federal pandemic funding is fading, and an affordable housing crisis that leaves too many straining to keep up their rental payments or desperately struggling to find housing that they can afford is looming. Some policymakers are responding by attacking housing first and pushing for alternatives like treatment first approaches, which could lead to uncertain outcomes at best or catastrophic spikes in homelessness at worst, based on available evidence of past performance. In this moment, we have an opportunity. We can leverage all that we learned during the COVID-19 pandemic about what our homelessness response, affordable housing, and healthcare and other systems can all do together with more funding and flexibility to get it done. And that's why I'm so excited for our panel of experts today. New research continues to illuminate our understanding of homelessness, its drivers, and the solutions that work, and each panelist will speak to a different aspect of this. First, we'll hear about the current state of the housing market and why this matters to homelessness policy from Senior Research Analyst Dan Emanuel of the National Low-Income Housing Coalition. Next, Dr. David Gonzalez-Rice, Policy Advisor to the Office of the Secretary, will share the most recent information from the U.S. Department of Housing and Urban Development on the state of homelessness in the U.S. and the impact of the pandemic. Dr. Tiana Moore, Policy Director of the Benioff Homelessness and Housing Initiative at the University of California, San Francisco, will then give us some really rich information about the latest findings on homelessness in California. And we'll round out our discussion today, hearing from a leading expert on the ground, Tasha Gray, Executive Director of the Homeless Action Network of Detroit, to tell us how these trends identified by researchers are playing out in real time in communities. After a Q&A, we'll hear from the Alliance's John Threlkeld about a recent legislative threat to Housing First and what you can do. Just a couple housekeeping notes before we dive in. We would love to hear from you, so please navigate to the bottom of your Zoom screen to locate the Q&A box where you can put in questions for the presenters. In case you were wondering, yes, this webinar is being recorded, and the recording, slides, and links all referenced during the presentations will be available on the National Low-Income Housing Coalition's website following the webinar, along with materials from past webinars in the series. As a final note, you will receive a notification for a 3-question survey about the webinar series and today's webinar, and we would really appreciate your feedback if you could fill that out. So without further ado, I'd love to turn it over to our first panelist.
Hey, everyone. Like Nicole said, I'm Dan Emanuel. I'm a senior research analyst at NLIHC. Most of my work at the coalition focuses on documenting rental housing needs around the country and working on something called the National Housing Preservation Database. Today, though, I'm going to be focusing on the former with a particular focus on the lowest income renters. Next slide, please. So since this is a webinar about homelessness and housing first, it's probably reasonable to start with the relationship between homelessness and housing, right? And there is indeed a well-documented relationship between the two. In fact, there are a range of documented housing factors that help explain homelessness, including rent levels, vacancy rates, eviction filings, and housing supply constraints. And these factors, I should also note, can influence each other as well. But ultimately, the bottom line is that when you read the research literature on this topic, what emerges is that housing is central to a structural explanation of homelessness. And we have to keep these housing factors in mind when we're developing housing solutions, which is what we'll talk about in a little bit. Next slide, please. So now that we've very, very briefly covered the relationship between housing and homelessness, I want to turn to what's going on with housing needs. So every year, the coalition puts together a report called The Gap, where we measure the affordability and availability of rental housing to different income groups. And specifically, we focus on extremely low income renters. And these are households that earn 30% or less of the local area median income or the federal poverty guideline, whichever is greater. Next slide, please. So what are the main takeaways from this report? Well, we estimate there are approximately 11 million extremely low income renter households in the United States. They make up about quarter of all renter households. And I should also note that households of color are much more likely to be extremely low-income renters in the first place. And overall, these extremely low-income renter households face a shortage of 7.3 million affordable and available rental homes. They face the most significant shortage of any income group. And as a result, about 72% of the lowest income renters are spending more than half of their income on rent and utilities. In other words, they're what we call severely cost burdened. And so they're facing a great deal of housing precarity, and they often have difficulty affording just other basic necessities in their lives. Next slide, please. And of course, this is not just a problem at the national level. The shortage for the lowest income renters impacts all 50 states and the 50 largest metropolitan areas. And when we use a different data source and look at the county level, nearly every county in the US faces a shortage of affordable and available housing for extremely low-income renters. Let's go back to the state level estimates. Next slide, please. This map shows our state level estimates for the number of affordable and available rental homes for every 100 ELI households by state. And the shortage ranges from 17 affordable available units in Nevada to 58 in South Dakota for every 100 ELI households. And besides showing a deficit in every state, you can see the problem is especially acute in the red color states, which are concentrated in the Western United States. So next slide, please. And like I said, there's also a shortage in every metro area we measure. And this includes metro areas characterized by both stronger and weaker housing markets, like Los Angeles and Detroit, for example. And in this table, you can see that regardless of whether you're looking at the affordability and availability of units, or if you look at the prevalence of severe cost burdens, there is a crisis of affordability for the lowest income renters in both metros. And the challenges are just a matter of degree, right? And of course, this matter of degree can have significant implications for implementing housing programs, especially ones that are market-based, like vouchers. Next slide, please. Naturally, all this raises the question of why the affordable housing crisis is so pervasive for the lowest income renters. Basically, it comes down to three things. First, the private market can't really produce new housing that's affordable to ELI households without subsidy, and older housing doesn't filter down in sufficient quantities. Second, ELI renters are very income constrained, so they typically can't afford the housing that the market does produce. And finally, and most importantly, third, we don't provide sufficient subsidy to make up the difference, either by producing enough affordable housing or boosting tenant income so they can afford the existing housing supply. In fact, only about 1 in 4 renters who qualify for housing assistance actually receives it. And I'll also add that we actually find that the share of HUD-assisted housing in the top 50 metros helps explain the prevalence of severe cost burdens for the lowest income renters in those cities, even when we control for other factors like rental vacancy rates, the share of rental housing in multifamily buildings, which is a proxy for density, and the age of the housing stock. So clearly, subsidy is key here, right? Next slide, please. So the shortage of affordable and available homes is not only pervasive across geographies, but it's also across time. And in fact, we've been short millions of affordable homes for ELI renters since we were first able to produce these estimates in the mid-aughts. And the shortages range from about 5.8 million homes prior to the Great Recession to about 7.6 million in 2013. The shortage really declined after 2013 until 2019, when it was approximately 6.8 million. And then, of course, we had the pandemic, an ensuing recession, and the deficit has again increased by about 500,000 homes to about 7.3 million in 2021, which is what we measured in our latest report. So next slide, please. So what do we know from more recent housing indicators, though? It's a fair question, right? The American Community Survey PUMS data, which we use for the gap analysis, only lets us produce housing estimates through 2021. But we can turn to data on median rent and evictions to get an idea of more recent trends. And if you're thinking rent went up in the past few years, it most certainly did. According to rental listing data from Apartment List, we saw a 25% surge in median rent between January 2021 and June 2022, before the increases started to taper off in the second half of 2022. So rent increases were very much part of the whole inflation story. And I should note here that wages for workers in the bottom decile only increased about 9% in roughly the same time period. On a more positive note, though, in 2023, rent increases have definitely slowed down sharply year over year, and we're seeing even some small declines in recent months. At the same time, according to Eviction Lab, COVID-era policies like eviction moratoriums and emergency rental assistance actually cut eviction filings by more than half between the start of the pandemic and the end of 2021. But according to their latest analysis, it looks like eviction filings were steadily on the rebound in 2022. So overall, the last few years have been pretty tough in terms of housing affordability, although rent increases are subsiding. I think it's still important to remember that, though, without further action, the underlying housing crisis will still be with us, and we're probably going to be dealing with a rebound in eviction filings. Next slide, please. So what kind of housing policies do we need for Housing First? Well, we need ones that impact the housing factors I discussed at the beginning of the presentation, and more generally address the underlying causes of the housing crisis for the lowest income renters. Most importantly, we need a federal housing safety net, and that includes policies like expanded or universal rental assistance, either through vouchers or a renter tax credit or a combination of both. It includes investments in preserving and expanding the federally assisted housing stock, housing stabilization fund to provide short-term emergency rental assistance to prevent evictions, and of course, federal renter protections with source of income protections, just cause eviction standards and limits on rent gouging. And of course, state and local levels have an absolutely essential role to play as well. And at those levels, we need to prioritize ELI and homeless households and state qualified allocation plans, and which are essentially the documents that govern LIHTC allocations in every state. We need to provide more gap financing for deeply affordable housing projects. And we also need to have stronger renter protections because, the state and local levels are really the venue for landlord-tenant law, right? And especially at the local level, we need to address housing supply constraints where they're an issue. So next slide. So to wrap things up, I'll leave you with three main takeaways here, right? One, homelessness is a housing problem. There are several housing factors that are integral to the structural explanation of homelessness, and addressing housing problems is really the key to ending homelessness. Two, there's a systemic and persistent shortage of affordable housing for the lowest income renters. And because of systemic racism, both in housing and employment, people of color are disproportionately likely to be counted in this group of renters. And three, we have the housing solutions to address homelessness, but we need to invest in them and pursue a range of policies at the federal, state, and local levels. And that's going to require help from everybody that's on this call today. And so with that, I will turn things over to David.
Thanks so much, Dan. Good afternoon, everyone. I'm David Gonzalez-Rice. I'm a policy advisor here in the Office of the Secretary. I'm particularly grateful for the opportunity to be addressing you all today. I got started in the homelessness response sector in 2013 as a shelter volunteer and then as a permanent supportive housing case manager. And so I know from that experience how powerful Housing First can be and what the challenges are in implementing it and what important work you and your teams are doing on a day-to-day basis to continue serving people in these programs. So let me talk a little bit about some recent data from HUD. I was invited today to highlight some findings in our annual homelessness assessment report to Congress. We call this the AHAR Part 2. Part 1 is a document that may be more familiar to a lot of you, which is the point in time count data. What the point in time count does uniquely, which the Part 2 report can't do, is it includes data on unsheltered homelessness and on people using shelters like domestic violence shelters being served by victim services providers. So we have the means with the point in time count to capture data for those populations as well. The AHAR Part 2, though we don't have an unsheltered count and have a less complete picture of people reporting or experiencing domestic violence, sexual assault, and human trafficking, it is year-round data, comes from HMIS data. So it's a complementary picture, and it gives us another way of understanding what's happening with homelessness around the country. So these data are for sheltered homelessness, and the period covered here is October 2020 through September 2021, the AHAR reporting year. So I'll often talk about it as 2021, but the actual period spans both years. In the AHAR Part 2, we can see that from before the pandemic through the end of this reporting period, homelessness went down, sheltered homelessness went down overall nationally by about 17%. And you can see some population breakouts there. For veterans, 18%, families, 25% reduction in sheltered homelessness. For individuals without children in their care, 13%. For youth, unaccompanied youth experiencing homelessness, 24%, and individuals with chronic patterns of homelessness, a 33% reduction in sheltered homelessness, importantly. Now, there were some really particular things happening in this time frame, which are highlighted here in the graphic on the right. Many of you will know about these factors from having worked in this setting. So factors driving reductions in homelessness. Importantly, an influx of resources to prevent homelessness and the eviction moratorium. So between the CARES Act, the American Rescue Plan, emergency eviction protection, rental assistance, there were a lot of measures that stemmed inflow or new experiences of homelessness, fewer people becoming homeless for the first time or seeking shelter to begin with. There was also reduced capacity in shelter, transitional, and supportive housing programs, which may also have had a depressing effect on demand for homeless services. And then, we think as well, based on what was reported from communities and from providers, that some people may have been more reluctant to seek assistance in a shelter or a congregate setting during this time. Other pressures that could have increased demand for homeless services included reduced capacity of rapid rehousing and permanent supportive housing programs. It was harder to move out of homelessness during the pandemic, and some of the economic impacts of the pandemic. So we know staffing challenges, increased competition for rental housing were factors that stemmed outflow. So in essence, the sort of turnover or the flow of people coming into and out of the homelessness response system during the pandemic slowed overall. And how it slowed, where it slowed, for which populations gives us some interesting lessons for thinking about how our homelessness response works going forward. Over to the next slide, please. So what I want to highlight here, and this is exhibit 1.12 in the report. So if you go and look for the AHAR Part 2 2021, you can find tables like this one throughout. And I've circled a couple of points here. The overall point being, for the interventions that we could characterize as housing first interventions, permanent supportive housing, or the offer of shorter term rental assistance like rapid rehousing, but also say a voucher with case management that isn't structured as permanent supportive housing per se. The number of people who exit sheltered homelessness to those kinds of interventions is really still quite low. So when I say that housing first is still too rare, what I really want to drive home is that it's a phrase that's on many of our lips. Our systems and our staff trainings and onboarding and the conversations we have with our peers are oriented around and toward housing first as a standard within the field. But for people who experience homelessness, housing first is still not the most common way that their episode of homelessness ends. And we're not able to offer a housing first intervention with a subsidy, either short or long-term, and the services, sort of person-centered services that person may need at anything like the scale of demand. Over to the next slide, please. Now, some of the speakers before me have already said, we also know that Housing First works, and the AHAR Part 2 gives us another several points of evidence that reinforce this. I've just pulled out here from these tables that are quite a bit larger. Chapter 7 is on households using rapid rehousing. Chapter 8 is on permanent supportive housing. Thinking of those both as essentially housing first interventions, I just want to draw attention here to the really low number of people who return to homelessness from any of these interventions, right? So whether it's rapid rehousing or permanent supportive housing, when people are, leased up, exit their homelessness with appropriate services, using these interventions, the returns to homelessness year after year are remarkably low. So for just about any programmatic intervention that a policymaker or somebody planning a response system wants to look at, these are enviable success rates. But back to the point I made on the previous slide, we're not offering nearly enough people these interventions to help them resolve their homelessness. Over to the next slide, please. So some takeaways from the AHAR Part 2, and we have a lot of other data points and reports from communities like the ones you all work in to round out this story. So safety net enhancements reduced new homelessness during the pandemic, kind of an unprecedented level of resources and protections for tenants to help reduce those new experiences of homelessness. And when you zoom in on the data, you can really see that the story of homelessness during the pandemic is largely a change in how many people are becoming homeless for the first time or returning to homelessness because there are measures to help them stay in the housing they have. We also know the continuums of care and housing providers faced heightened challenges moving people into housing. So staffing challenges, increased rental costs, increased competition for housing, all slowed the ability of otherwise really kind of high-performing systems at moving people out of homelessness and into housing. So those two factors at the same time kind of pushing the overall numbers in different directions. And then, given where we are now, we know that these safety net enhancements are largely done by now or winding down toward the end of their time. And those challenges faced by providers are pretty much still in place. It's still hard to staff up your programs. Labor costs are still high. Housing costs are still high. And so although the AHAR Part 2 is only telling the story through 2021, I don't think it'll be a surprise to any of you on this call that, what communities are reporting to HUD and to our federal partners more recently, indicates that, we're expecting to see data moving in a more concerning direction, right? That homelessness is climbing in many communities around the country, and we'll be seeing more national data in the coming months to tell us the rest of that story. Another bigger point I want to make, or just re-emphasize, Housing First, again, it's high profile, it's in the headlines, we talk about it at our conferences, but it's still not a common enough offering for people who are experiencing homelessness. And when I say most people experiencing homelessness aren't offered Housing First as an intervention, I'm just talking here about how available it is as a resource. It's not resourced enough, right? Those of us working in this sector would love to be able to offer the Housing First model to everyone who's in shelter or in an encampment, and we're just nowhere near there. And then finally, the Housing First that is in place is under-resourced. And I think what the AHAR Part 2 shows that does point to this fact is how the exits from sheltered homelessness to housing slowed during the pandemic. Again, staffing challenges, competition for rental units, but also just the fragility of the infrastructure in continuums of care in the nonprofit sector, in coordinated entry systems, that capacity to collaborate, to case conference, to do the highly skilled labor that's involved in implementing Housing First was really taxed. And that's a lesson I think we need to take going forward. To the next slide, please. So what is needed? We need more and better supported or better resourced Housing First. So a couple of steps that we here at HUD and our colleagues across the administration and the federal government are taking in this direction that are not sufficient, but are a start. We put out our 2022 special notice of funding opportunity for unsheltered and rural homelessness. That was really important to us because when you look at subpopulations of people who are experiencing homelessness, the sort of the disproportionality between the availability of Housing First and the number of households who need it is especially strong for individuals without minor children, right? So we need more Housing First for families. We need more resources for veterans to bring an end to veteran homelessness in this country. But it's particularly when we're looking at non-veteran individuals without children in their care that the shortfall of Housing First interventions relative to the need is at its absolute highest. So where our agency had the discretion to put recaptured funds out in a special notice, we attempted to address that, that gap by directing resources toward communities that will be addressing encampments, and stability vouchers went out with a similar intention. I want to mention also that we were, as the federal agency whose mission is to address housing and strong communities around the country, we do get asked by our colleagues on the Hill and in the White House Office of Management and Budget what authorities or legislative language we need to carry out the mission, carrying out the programs and the laws that Congress passes. And so the Senate fiscal year 24 budget proposal that's out now includes some language that staff at HUD worked on with our colleagues over on the Hill, which would include making the continuum of care competition run every other year. That's important to us as a way to reduce burden on staff who are delivering these programs and create some more efficiency so that Housing First providers can focus more on the work and the mission and less on the reporting and the competition. And it also includes a proposal for a $25 million inflationary adjustment for continuum of care services costs, recognizing the need to attract, retain, and compensate staff. So appreciate the partnership with our colleagues in the appropriate committees there in the Senate on looking at those potential solutions with us. And then an administration-wide priority really in strengthening safety nets and tenant protections. I'll draw attention to a couple of actions here. Last month, the Biden-Harris administration announced a number of actions to strengthen tenant protections. These included measures for people to appeal or correct credit reports that are inaccurate and causing them difficulty on the housing market, augmenting fair tenant screening practices, and funding for tenant education and outreach, or funds for tenant organizing out of the Department of Housing and Urban Development. So again, we need to do a whole lot more of these kinds of actions, but these are the kinds of things our administration is committed to doing, moving us in the direction of better and more supported Housing First. That's addressing your ability to move people out of homelessness and into housing, but then also the really critical lesson from 2021 and from the pandemic And as the previous speaker said, homelessness is a housing problem. Unless we can stem new experiences of homelessness and strengthen people's ability to remain in the housing that they have, it'll be very difficult to resource housing first interventions up to the point that they can keep up with continual new demand. Over to the next slide, please. So to wrap up, I want to draw your attention to a few resources. I think these will go in the chat or get sent around for you to look at later. You can Google 2021 AHAR Part 2, find the tables I drew your attention to here. Our Office of Policy Development and Research just published its Evidence Matters Quarterly. This quarter's theme was Housing First, a kind of a roundup of evidence over time, recent evidence. It's really a great kind of summary of the state of the field, and I think good intervention in the conversation that we're having today. And lastly, this fact sheet released in July on the Biden-Harris administration actions to protect renters, addressing some of those upstream effects that we know are so important. So with that, I'll hand it over to the next speaker, but thank you all for your attention today. Look forward to the conversation later.
Thank you so much, David, for that wonderful, wonderful overview. Hi, everyone. My name is Dr. Tiana Moore. I am the Policy Director at the UCSF Benioff Homelessness and Housing Initiative. And as Nicole mentioned at the top of the talk, I'm here to chat a little bit about our recent study, California statewide study of people experiencing homelessness. I'm having a little bit of difficulty advancing. Oh, I think I'm good now. Great. Just so I can orient everyone to the full report, it's accessible at homelessness.ucsf.edu/CASPA, C-A-S-P-E-H. And to just give a quick overview, CASPA is the largest representative study of homelessness since the mid-1990s. And so our team from November 2021 and October 2022, we surveyed thousands of adults experiencing homelessness within the state of California across 8 counties in the state of California to really provide statewide estimates of who experiences homelessness in California, what was going on in the lives of individuals prior to homelessness, their experiences of trauma and stress that participants had both prior to experiencing homelessness and during their current episode of homelessness, and also their mental and physical health and well-being, and finally some barriers to exiting homelessness that folks shared with us along the way. So I encourage everyone to access the full report. I am unable to kind of talk about all of the findings that we have in this really rich 90-page report in the 12 minutes that I have with you all today, but would love to kind of highlight some of our key findings that are related to behavioral health, but also provide some contextualizing information before diving into those findings as well. So with regard to study origins, we really conducted the study at a time where the state of California had expressed a desire to make some pretty significant investments in homelessness across the state, but really needed key data to inform some of those decisions that were being made. As context, California has 12% of the overall United States population, but we are home to 30% of individuals experiencing homelessness. And further, we're home to 50%, so half of all people experiencing unsheltered homelessness live in California. And in terms of significance, again, it's the largest representative study of homelessness in the United States since the mid-1990s. Some quick methods before we dive into some of the data. So we basically carved California into 8 regions and selected randomly a county within each of those 8 regions to conduct our study within. And that county stood in for the entire region. We were interested in understanding adult experiences of homelessness. So all of our participants were 18 and older at the time of the survey. And the number of participants that we surveyed within each county differed based on both the size and composition of homelessness, of the homeless population, I should say, in each of the counties. Overall, we conducted 3,200 questionnaires, and we also conducted with about 1 in 8 of our participants these paired in-depth interviews where we were able to ask more open-ended questions that we weren't able to capture in the questionnaire. We used venue-based sampling, which is just kind of fancy statistical jargon for saying we met people where they were. We were in encampments, we were in hot food lines, libraries, spaces where people experiencing homelessness live. And we also augmented this with, or supplemented this, I should say, with respondent-driven sampling, which is a statistical technique to really harness the social networks of individuals from harder to reach populations experiencing homelessness. For this study, this included our farm workers, this included participants who were, who identified as part of the LGBTQ community, and also our transition age young adult participants. We conducted sample weighting to produce statewide estimates. So the study isn't designed to talk about a particular county, but it's more so designed to talk about the state as a whole. We conducted our surveys and our in-depth interviews in both English and Spanish, and also used interpreters when we needed. And then finally, and then also probably most importantly, we really kind of embraced community engaged practices throughout the study. So from the time that we were developing our survey instrument to the time that we are in now, where we're currently disseminating our findings, we really relied upon 3 community advisory boards. One of our advisory boards was notably composed of people who either had lived experience or living experience of homelessness. And some contextualization before we jump into some of our findings about the participants in our studies. So with regard to race, our Black and Indigenous participants were disproportionately impacted. In our study, 26% of all participants indicated a Black identity, whether it was their sole identity or one of their identities. But when we look at California as a whole, it's about 7% of all Californians do so. With regard to Indigenous communities, so our Native American, Alaskan Native, Indigenous identified individuals, in our study, 12% of people identified as Indigenous, but when we look at the state of California as a whole, it's about 3%. With regard to gender, our sample was primarily male. So we look at our cisgender men composed most of our sample. So 69% of our sample were cisgender men, 30% were cisgender women, and 1% identified as transgender, non-binary, or other gender identified. When we look at our younger adult sample, so our 18 to 24 individuals who didn't have children living with them at that time, it's about 6% who identified as trans or non-binary. California's homeless population is aging. The median age of all of our participants was 47, and the range of participants, it ranged from 18 to 89 as our oldest participant. When we look at just the single adults in our sample, which were about 90% of our sample, the median age was 49. And notably, about half of our study participants overall were 50 and older. 41% of these single adults were 50 and older when they first became homeless. Episodes of homelessness were long. So the median length of the current episode of homelessness was nearly 2 years for participants, so 22 months. And 1 in 3 participants, so 36%, met federal criteria for chronic homelessness, which of course has both a temporal criteria that you have to meet, either experiencing homelessness for 12 months or more, or 4 times or more in the past 3 years that equal to 12 months. And then also having a disabling condition as well. And 36% of our participants met both of those criteria. Homelessness doesn't occur in a vacuum, and oftentimes homelessness is the culmination of lifetime experiences of stress and trauma. With regard to incarceration, about 79% of all of our participants either went to jail or prison at some point in their life. 77% spent time in jail, 37% spent time in prison. We also heard from our participants very high rates of violence enacted upon them in their lifetime. 72% of all of our participants experienced physical violence at some point in their life enacted upon them. And also a quarter of our participants experienced sexual violence. And notably, this was higher amongst our cisgender women and also our trans, non-binary, gender conforming participants, where 74% of those individuals indicated that they had experienced sexual violence at some point. What I think is important to also highlight with regard to violence is that oftentimes our participants spoke about knowing their perpetrator of violence before their current episode of homelessness. But during their current episode of homelessness, oftentimes the perpetrator of violence was a stranger. Entrances and trajectories to homelessness really differed. So about 1 in 5 of our participants entered homelessness directly from an institutional setting, and this was primarily exiting prison, primarily exiting jail. About half of our participants entered homelessness directly from a non-leaseholding situation. And these are participants who were doubled up, who were living with family or friends, not formally listed on a lease agreement. And 32% of our participants indicated that they entered homelessness directly from a leaseholding arrangement. So their name was formally on a lease in their previous housing before they actually entered homelessness. What I also think is important to note is that there wasn't one typical pathway to homelessness that our participants described. There were some participants who reported this kind of rapid transition to homelessness, while others often described kind of using these limited financial resources that they might have had or their social networks to really stave off homelessness for as long as possible, to really slow their descent into falling into homelessness before ultimately entering homelessness. And one thing that I'll also note in this slide is that the kind of precipitating factors to homelessness also differed by leaseholding status. We asked our participants a range of questions around kind of what was going on in your life prior to homelessness, what were the precipitating factors, what do you attribute as the primary reason for you exiting homelessness, and oftentimes, or entering homelessness, I should say. Oftentimes our leaseholder participants had indicated that a loss of income or some other financial precipitant was a dominating factor that contributed to their entrance to homelessness. Our non-leaseholding participants often talked about kind of these social factors, or factors that we talk about as social, these interpersonal conflicts that they might have had with the people that they were living with at the time. But oftentimes what really came through in our qualitative interviews was that an economic shock or an economic event really was the precipitating factor in the upstream way that caused them to kind of live in these overcrowded or contentious living situations. A really important part of the picture is really thinking about how income and housing costs really lead people vulnerable to homelessness. So when we think about all of our participants, the median monthly household income prior to experiencing homelessness was just $960. Across all participants, the median monthly housing cost was $375, but this is probably a lower number because 43% of all of our non-leaseholders did not pay rent in their last housing arrangement. When we look at this by leaseholder status, it's a little bit of a different story. So $950 was the median monthly household income for our non-leaseholding participants, and their median monthly housing cost for those participants who did pay rent was $450. So that's about half of income being expended on rent. Leaseholders, it was also an untenable situation in which the median monthly household income was about $1,400 for our leaseholders, and the median monthly housing costs for our leaseholders was $700. So again, expending about half of your income on rent. Our participants had very little warning prior to losing their last housing. Across all participants, the median warning before losing their housing was 5 days. Our non-leaseholders, it was 1 day, and our leaseholders, it was around 10 days. So now I want to kind of walk us through some of the findings that we had around behavioral health, both mental health and substance use, starting with kind of mental health during the current episode of homelessness. 66% of all of our participants reported any mental health condition, and this was primarily dominated by anxiety and depression. And these are kind of severe anxiety, severe depression. 37% of our participants reported trouble remembering, concentrating, or understanding. This can often be a symptom of other cognitive impairment. And 12% of our participants indicated that they had experienced hallucinations during the current episode of homelessness. What I didn't capture on this slide, but I think is important when thinking about kind of mental health severity, 27% of all of our participants have been hospitalized for a mental health condition at some point in their life. 56% of those individuals experienced that hospitalization for the first time prior to entering homelessness. What I think is also really crucial to understand is that homelessness often limits access to treatment, whether it be mental health treatment or substance use treatment. Despite the really high need of mental health conditions within our population, only 18% of all of our participants received either mental health counseling or medication in the 30 days before we interviewed them. With regard to substance use, we asked our participants about current regular illicit drug use in particular. By that measure, and I should go back and say regular, we define this as 3 times a week or more. With regard to any substance, about 35% of our participants indicated that they had used any substance 3 times or more a week during this current episode of homelessness. And this was primarily driven by methamphetamine use, which would happen, or methamphetamine use 3 times or more a week. So 31% of our participants indicated that they use methamphetamines 3 times or more a week. 3% indicated cocaine use, and 11% indicated opioid use 3 times a week or more. What really came out through our qualitative interviews was that oftentimes people use substances instrumentally, particularly our unsheltered participants, as a means to stay vigilant, as a means to kind of maintain their safety and maintain their vigilance while unsheltered. With regard to heavy episodic alcohol use, I think it's commonly referred to as binge drinking. About 16% of our participants indicated heavy episodic alcohol use during the current episode of homelessness. 11% of our participants reported an overdose during the current episode of homelessness. And again, going back to the ways in which homelessness limits access to treatment, 1 in 5 of our participants who reported current regular illicit drug use or heavy episodic alcohol use indicated that they wanted treatment, but were unable to access it. We were also really interested in understanding how substance use changed during the current episode of homelessness. So for our participants who reported ever using substances, not just during the current episode, but ever in their life, 38% indicated that their substance use stayed the same, and equal amounts reported decreases and increases. But I think it's important to note that this finding really differed when you look at different family structures. So this is for single adults that don't have children, so those who are 25 and older with no children, the results look pretty similar to what's on the screen. But when you look at adults that were living with minor children at the time of interview, we saw much higher percentages of decreases of use. For transition age young adults, and these are adults that are 18 to 24 without minor children living with them, we saw much higher increases during the current episode of homelessness. Finally, we asked our participants about some of the key barriers to returning to housing. Firstly, I think we were hard pressed to find any participant who said that they were not interested in accessing permanent housing. And nearly all of our participants indicated that high housing costs were the primary barrier, or were a barrier to them entering permanent housing. About a quarter of our participants indicated that a physical disability was a complication to entering housing again. Mental health and substance use, about 29% of our participants indicated this. 36, so about 1 in 3 of our participants indicated that having a prior carceral record really hindered their ability to access permanent housing. Lack of documentation, about half of our participants indicated this. Discrimination, whether it be identity-based discrimination or housing or homelessness status discrimination, about 43% of participants indicated that this was a barrier. Credit history or past evictions, half of our participants said that they were impacted by this when finding housing. Wait lists, long wait lists for either housing or for vouchers, about half of our participants indicated that this was a barrier. And then finally, family and friends not being able to have family and friends who were able to have them live with them, about half of our participants indicated this was a barrier for them as well. So we were also interested in understanding what support looked like during the current episode of homelessness, specifically support finding housing. So 2/3 of our participants indicated that not having help from someone, whether it be case manager, housing navigator, et cetera, really posed a barrier to them finding housing and exiting homelessness. Little less than half of our participants reported receiving formal assistance finding housing during their current episode of homelessness. And when we look at kind of frequent contact, it gets even smaller. So about a quarter of our participants indicated that they received help finding housing either monthly or more frequently in the past 6 months. Our sheltered participants reported kind of receiving this help more frequently. 44% of those who were living in sheltered locations most often in the last 6 months reported having kind of more frequent support finding housing compared to our unsheltered participants who only 20% indicated receiving such help with that frequency during the period. So to tie this all back to Housing First, really thinking, wanting to emphasize that Housing First is an evidence-based approach to housing people experiencing homelessness. It's a philosophy. And thinking about alternatives to Housing First, what the research really bears out is that Housing First, compared to Treatment First models, these alternatives to Housing First really struggle with engagement. And really at the core of this is that housing offers the stability that individuals need to really engage with services. There's robust support, really rigorous evidence and in support of Housing First principles across populations. Housing First really works even with people that have severe behavioral health disabilities. And finally, the model of Housing First, permanent supportive housing that incorporates Housing First principles, is really important. It's subsidized housing with voluntary services that are linked. And it also, it's what really the research has bore out is that PSH that incorporates very intensive service models, rigorous service models, has been really successful in housing people, even with really behaviorally complex needs. BHHI, the Many of Homelessness and Housing Initiative, we conducted a study in Santa Clara in which we were able to successfully randomly assign a group of individuals that had incredibly complex behavioral health needs. And 86% of them were able to be housed, and in the 7-year follow-up, 90% of them still remained housed. Chez Soi, which is a demonstration that happened in Canada, across 5 cities in Canada over many years, was also able to show the same. We're able to successfully house individuals when we're able to meet their needs with really rigorous and intensive services that are voluntary rather than conditioning someone's ability to access housing upon those services. And with that, I'll pass it to my colleague, Tasha.
Thank you. Hi, everyone. My name is Tasha Gray, and as the slide indicates, I am the Executive Director at the Homeless Action Network of Detroit, or HAN. We are the collaborative applicant here in Detroit, and we are also the HMIS lead. As I sat here and listened to the presentations of my colleagues, Dan Emanuel, Dr. David Gonzalez-Rice, and Dr. Tiana Moore, I, like you, probably felt I felt heard and I felt seen through some of this research based on what we are seeing and experiencing here on the ground. So I just want to give you a little bit of background about what we're experiencing here in Detroit. And as Dan Emanuel said earlier, although the scale may be a little bit different, I'm sure that we are all experiencing some of the same things. So even in some of our differences, there are more similarities than differences. So again, just want to share a little bit, and then I won't be before you too long because I want to make sure that we have time for questions at the end. So in Detroit, we are seeing an overall decline in homelessness. But like was shown from my colleague from HUD, some of that decline in homelessness may be artificial, right? Because especially during COVID, what we also saw here in our community was some people who were reluctant to come into the homeless system, especially to utilize the shelters. If they were congregate spaces, we saw a reluctance from that perspective. We also had shelters and other facilities, especially in congregate places where they were taking shelter beds offline to make space for more social distancing. So while we have seen an overall decline in homelessness, we do recognize that we expect in the not too long future to see some of those numbers increasing as things more return to what we consider, I guess, the new normal. Our homeless population, by and large, is singles experiencing homelessness. However, we are starting to see increases in families that are experiencing homelessness. 30% of those experiencing homelessness in our community are families. And when we start to see spikes in homelessness in our community, oftentimes those spikes in homelessness come from 2 categories. We see them in families who are experiencing homelessness, and even more so in the children within those families, so larger families. But we're also seeing increases in people who are experiencing chronic homelessness. So that's what, on a day-to-day basis, our homelessness looks like. Some of the impacts that we have experienced here in Detroit as a result of COVID, it's probably quite the conundrum, actually, because we would anticipated a lot of negative experiences. And of course, COVID was a tumultuous time for us. But quite the opposite. When here in Detroit, what we saw was a rallying around the homeless system. And we saw an influx of resources, whether that be financial resources. We saw a mobilization of partnerships coming from public, private, and from the nonprofit partners. And so there were more resources that were pouring in for people who were experiencing homelessness. We even had better attention to our facilities. For years, we had seen some of our shelters and other places where the facilities maybe have not been in the best shape, but we begin to see resources to be able to do some renovations in our facilities, and of course, create some non-congregate living spaces. So all in all, what we saw in Detroit and the impact that COVID had on homelessness was actually a positive impact, because we started to see the mobilization of resources, and we started to see the mobilization of partnerships that we had never seen before. And so it really begs us a question that if we can do it in that time, a time of COVID, then why can't we do it going forward? Because what we're starting to see now, as some of those resources begin to dial back and some of those partnerships begin to fade away, is that, of course, what happens when you pull back is that we're now starting to see more people experiencing homelessness. We're starting to see our shelters become full again. And so I would encourage our partners, our federal partners, our state partners, even our local partners, to keep the same energy that we had during COVID, because people, whether they're experiencing whether it's during COVID or not, deserve safe, affordable housing, right? I'm sure that you all would agree with that. Some of the things that we were able to do in our community to move the needle around homelessness is it really has been investing in the things that we know work, right? We know that housing first works. And we've seen it in the research that was presented today, but we're seeing it in our own communities. And here in Detroit, we use a housing first model, and we hold our providers to that model, and we're making sure that there is fidelity to that model. And as we invest in that housing first model, what we're seeing is retention and permanent housing. We see rates of retention of upwards of 99%, and that is fantastic. And I'm sure that you all are seeing that in your communities as well. And we're seeing it even when we prioritize people who have greater barriers and higher needs, because that's what we do here in our community, is we make sure that they are prioritized for housing. So even when we prioritize them, and I believe Dr. Moore said this, even those with higher vulnerabilities and higher barriers are doing well with a housing first model. And so those are some of the things that we continue to push in our community. We also took advantage of some of the resources that were flowing as a result of the COVID, right? And so we were able to take advantage of some of the emergency housing vouchers and leasing those up very quickly. And it wasn't just the voucher in our community that made the difference, but what really made the difference is pairing those vouchers with the services so that people didn't fall through the cracks and didn't lose out on those voucher opportunities. And so being able to beef up our navigation and having really intense services that not only once they were placed in the housing, but even leading up to placement, having those intense services from day one really made the difference in our community. One of the things that was also really great in our community is with the emergency rental assistance, our state decided that that money would actually flow through the continuum of care. And so throughout the state, the COCs in our state were the recipients of the emergency rental assistance dollars. And while it was a tall task for many of us, it was probably more resources than we've seen, maybe even in the existence of our organization. I know it was for ours, and we had to stretch ourselves a bit, but because it came through the continuum of care, we were really able to make sure that our people experiencing homelessness didn't miss out on the wealth of resources that were flowing through. And then lastly, we are still experiencing challenges though, even though we've seen decreases in homelessness, right? Even though we've invested in models that work, we still experience challenges, as I mentioned earlier. And this is an unprecedented time for us where we're seeing our shelters full. And that's not typical, especially not during this time of the year. But some of the reasons we're starting to see full shelters and shelters being at capacity on a daily basis is, one, we're starting to see those dollars roll back. So the investments that were happening during COVID now are expiring. And so we're starting to see more people and different people now who are entering into shelters. These are some of folks that we have never seen before. And they during COVID had resources. They had SNAP benefits. They had unemployment benefits and things of that sort. And now those resources are going away. And so we're starting to see them enter our system. Another reason why we're seeing full shelters in our system is, as the research pointed out in Dr. Tiana Moore's research, is that we're seeing longer stays, longer lengths of time of people experiencing homelessness. And I know if your community is anything like our community, while we saw an influx of resources during COVID, it was also a very challenging time because of staffing, right? And so we couldn't staff up quickly enough at times to be able to really spend those dollars. And so we're still having some of those residual effects from our labor market, right? Where we're having problems being able to fill vacancies. And what does that do to the people who are experiencing homelessness? That probably means that we're not providing as great a depth of services. We're not filling our vacant units as quickly as possible because we have this gap in staffing. And so we, as a nation, we've got to, and as continuum of care, as service providers and those who are working in a homeless field, we really have to band together, and we're going to have to do some things to really address this labor shortage that we are experiencing. And then lastly, one of the things that we're seeing is, as Dan Emanuel pointed out, is a tighter housing market. It may not be to the degree that some of you folks see on the West Coast, but we're certainly seeing units that would traditionally be able to be rented to people experiencing homelessness are just not on the market anymore, combined with the fact that we have poor housing quality stock in Detroit. And so it is just becoming a storm of things that are all colliding and happening at the same time. But yet and still, we are continuing to invest in housing first because we know that the model works. It has worked in our community. The data shows it in our community, and we will continue to invest in that model. Thank you for your time.
Thank you, everyone. Can I ask all of our panelists to come on camera now so we can chat? Awesome. Wow, so much to dig into, and I've seen lots of questions in the Q&A, so thank you to everyone who has done that. My first question to our panel is, to be frank, several communities across the country have recently released numbers indicating that homelessness is increasing. Some people are responding to this by saying that that's evidence that housing first policies aren't working. I would love to know what each of you would say to them. And I think I will start with Dan, if you can highlight the intersections with affordable housing.
Sure. I mean, I would just emphasize to them, the wider context of inflation that we've been living in, right? And rent is a key part of what's been going on there. And as I talked about in my presentation, there was a period recently where it went up 25%. So, how could you not expect homelessness to increase when rents are going crazy like that? I mean, it defies common sense to really look at it in any other way, in my kind of view. So that's what I would say to them.
Great, thank you for that context. Tiana, how would you respond based off of the research you highlighted?
Yeah, I would say a few things, and probably in Dan's space a little bit. When we don't have the housing to actually get people out of homelessness into, of course, it's going to look like housing first doesn't work when housing is not available. I also want to just highlight the fact that oftentimes, fidelity to the housing first model is something that we need to be mindful of. Oftentimes we look at housing first programs that don't have the outcomes that we want, but it's really because the intensive, high quality services that are needed to actually have people thrive in a housing first model aren't available. And I would lastly say, it's a imbalance between inflow and outflow. And I know that David highlighted this in his talk as well, but when we have more people falling into homelessness and we're able to exit homelessness, numbers are going to increase. So I would say the combination of those three would be my response.
Thank you. Next, I'm curious to know what would happen if HUD was prevented from promoting housing first or required to set aside funds for providers who were not engaging in evidence-based policies. Tasha, can we start with you from your perspective based on leading homelessness response in Detroit?
Absolutely. Thank you for the question. Yeah, I would say that if HUD is not allowed to allocate a good majority of its resources to promoting housing first, we're going to have a real big problem. As I mentioned earlier, and I know that some of my colleagues across the nation are doing this as well, is that we do a lot of targeting in our community of our resources to those who have higher needs. And so we're making sure that they get in housing and they get housed first, and we're making sure that they have the resources that they need. And so if we start to pull away from that, then we're going to start to see more people with higher needs who are living on the streets or in our shelters. And inevitably, what we will start to see is I think some believe that housing first is an expensive model, and all things have a cost, right? But I think we'll start to see even greater expenses as we start to pull away from what we know works.
Thank you. A lot of people have been asking questions in the Q&A about housing first for specific populations. I would love if one of our panelists could address the research on housing first and supporting people experiencing mental health crises, significant substance use, or other medical vulnerabilities.
I'm happy to take the first stab at that. I think one of the kind of clearest examples when thinking about kind of special populations, the clearest example of housing first really being effective is when we look at our veterans. So HUD-VASH, which is the program that's the collaborative kind of program between HUD and the VA that combines rental assistance and case management and high quality clinical services, is really kind of the root of the decrease in veteran homelessness that we've seen over time. So a 55% decrease since 2009, which is pretty significant. In terms of folks who have kind of pretty significant behavioral needs, whether it be kind of mental health conditions, whether it be substance use disorder, a lot of the research has borne out in support of housing first as well. I mentioned this briefly during my presentation, but Santa Clara The Project Welcome Home is a study that we conducted at BHHI, where it was a randomized control study of chronically homeless individuals with probably the most behaviorally complex needs within the county of, or within the city of Santa Clara. Again, we were able to, of the people who were assigned to the Housing First treatment, 86% of those individuals were housed. And then in the 7-year follow-up, 90% of those individuals remained housed over time. I think some really critical outcomes from that particular study was that it decreased the use of psychiatric emergency department care and also decreased shelter use during that same period. And then the last thing that I'll talk about, just kind of in terms of one of the most seminal studies around Housing First, is really looking at New York City's pathways to housing, which really provided folks with immediate access to housing, even if they had kind of very severe psychiatric disabilities. But importantly, it was linked with these really high quality services. And ultimately what that study showed was that folks who received kind of Housing First treatment option spent less time experiencing homelessness. They obtained housing earlier. They remained stably housed over the study period. In fact, 88% of those participants remained stably housed versus 47% in the control. So I think what kind of the culmination of what the research says on Housing First is that we're able to house even folks who have the most complex behavioral needs if we're able to kind of meet their needs with high quality services.
If I could, Nicole, I'd like to expand a little bit on what my colleague was just saying there. I think it's important in our conversations about the effectiveness of Housing First and its outcomes to bear in mind that a really important half of that equation is who's targeted for the intervention and who is the intervention reaching. I think there's an interesting overlap increasingly with our discussions around homelessness prevention. So some of the recent research that's been done around homelessness prevention really points to the fact that it's more cost effective, or the impacts are larger, the more that it's targeted to people who have certain risk factors, like having experienced homelessness in the past, for example. So if your end goal was to produce a homelessness prevention program that had a 100% success rate, you might target it to people who had less history of homelessness, higher income, and fewer barriers. But that's not the goal, right? The goal is to create an intervention that has the biggest overall impact on reducing homelessness in the community. And to do that, it needs to be targeted. And I think in Housing First, as I said earlier, the success rates are sort of enviable for anyone who's considering, designing an intervention to address a really challenging issue. And we have to insist in the conversation about Housing First that outcomes aren't just about being able to say every single person who's ever left our program has gone on to remain stably housed for the rest of their life and flourish and thrive, but as the other half of that equation to say, our program reached people who are living outdoors, who've been unsheltered for a long time, and our success rates were admirable or worthwhile, but they don't need to be 100%, because if we have a program that never has a tragic story in it, then it's probably not reaching the people that it needs to reach.
Thank you for adding that. I think that's a great segue into asking a question posed by George, which is, what is your guidance on the type of housing that is appropriate for the first housing provided to someone experiencing homelessness? Is there any thoughts or guidance that any one of you would have on that? I'll open that to everyone.
I would like to speak to this briefly, and I'm hoping some of my colleagues can fill it out a little bit more. The short answer is whatever housing that person wants and expresses some a desire for and can talk with their services provider about some plans to put in place to set them up for success, right? So this is, again, where the person-centered aspect of delivering housing first is really important. So the size of the unit and whether it shares walls or not and where it's located and how close it is to transportation, even whether it's shared housing or individual housing. And speaking from my time as a practitioner, down to is this a longer term lease or a shorter term lease? What is this person who's sitting in front of me in our planning interview comfortable with and looking for? And so it should be a situation that can be tailored. I think that a Housing First program needs to be able to accommodate a client's preference to go directly from their encampment into a lease, and then talk to the next client who says, I want to go into a treatment program first, but it's really important that that person has an offer of housing to exit the treatment program from, so that they don't have to go back to homelessness first. All of those sort of pathways and routes out of homelessness are consistent with the approach. It's, again, always a question of resources to be able to provide that diversity of options and the sort of capacity of staff to be able to tailor to that extent. But that's what I would say.
Thank you for highlighting the importance of choice in designing these interventions. I am sure other people could speak to that as well, but looking at the time, I think my last question to everyone will be, we've talked a lot about the last few years, what we've seen and what we're facing now. Could you briefly, in a sentence or two, offer your reflections on what you're looking for moving forward, whether that's trends or promising solutions? And I guess we'll just go in order that you spoke. So we'll start with Dan.
So the question is what I'm looking forward to in terms of solutions. I think that's a tough one. What I'd really like to see first and foremost is a significant expansion of federal rental assistance, so we actually have a housing safety net. Because I think a lot of our capital subsidies, like LIHTC, actually are highly dependent on federal rental assistance to actually reach the lowest income households, including homeless people. So my view, what I'm most hopeful for and what I most want to see is really just a universal housing entitlement for rental assistance.
So for my part, I mentioned the special notice of funding opportunity that HUD put out. There are a number of communities around the country that put together really impressive plans to deploy those funds and make use of stability vouchers. We also have the White House-led initiative All Inside, working with a handful of communities around the country in a really concerted way to address homeless encampments. So my somewhat lower aspiration than Dan's, and just what I'm looking forward to in the next year, is to see what comes out of those communities as far as the proof points for continued creativity and problem solving in keeping the faith with Housing First in communities across the country.
What I'm looking forward to is really seeing a coordinated effort at all levels of government, federal, state, local, to really have a dedicated focus on producing, preserving, and protecting affordable housing. At the end of the day, I think from the study, $960 a month as your kind of last income before losing your housing always sticks with me. And also thinking about the extreme rent burden that people are under. And so anything that we can do to make housing more affordable in California and across the nation, and that will take coordinated effort across all levels of government. And secondarily, I think what I'm also hoping for is an increased focus on looking at the needs of older adults experiencing homelessness. I think it's pretty striking that, at least in California, nearly half of our sample population were older adults 50 or older that have very unique needs that can be supported in kind of a permanent supportive housing model. Some of them need that. But I think that having that kind of dedicated focus on ending older adult homelessness and being responsive to those unique needs are important.
And I would say what I'm looking for is like all of my colleagues, but especially like Tiana, is that I'm looking for commitment from federal, state, local, and a commitment, yes, in the form of resources, financial resources, but also commitment to finding solutions and being innovative. We've been able to do some of these things through VASH, YHDP, EHV. So I want to see that level of commitment kind of across the board and not just for certain populations, but we all deserve that safe and affordable housing.
Thank you so much, each one of you. I know we didn't get to a lot of questions, so I'm sorry for that, but there's just so much to talk about. Now we will hear from the Alliance's John about our policy developments related to Housing First.
Hi, I'm John Threlfeld, and I'm the Alliance's lobbyist, and I'll be talking fast. So I hope you can keep up. But if you've been following these webinars, you know how effective Housing First, housing and services is at getting people housed, particularly those with the most acute needs, that Housing First decreases homelessness, and that Housing First increases housing stability, that Housing First is far more successful than the discredited treatment first, so-called tough love approach, that Housing First is successful with all different kinds of groups, from the justice affected to the victims of domestic violence, to the elderly to veterans, and that the economic benefits of Housing First exceed the costs, and that Housing First promotes health while reducing healthcare costs to such an extent that even big insurance carriers are investing in permanent supportive housing. The only problem with Housing First, as we've heard from several of our panelists, is that we don't have the resources to bring it up to scale so that everybody eligible can benefit from the housing and services of Housing First. And if you haven't been following these webinars, that's too bad, but you can catch up with the Housing First fact sheet, which will be included in the chat room. I intend to use the next few minutes to talk about a specific piece of legislation that would undermine Housing First, the Housing Plus Act, HR 3405. Next slide, please. That's an excerpt on the slide from a recent press release by Representative Andy Barr, an influential Republican lawmaker from Kentucky's 6th District. Quote, Barr reintroduces bill to fix failed Housing First policy, unquote. The title of his anti-Housing First legislation is the Housing Plus Act. And what is the plus? Well, plus stands for promotes livelihood and ultimate success, unquote. But I think Representative Barr would say that the plus really is the wraparound services he mentions in the press release. Housing and services. Now that sounds a lot like Housing First, but not to Representative Barr, who is an impassioned advocate and an accomplished debater. He has said, quote, Housing First is housing only, unquote, and that only non-Housing First providers offer services, even though it is understood by HUD, VA, state and local governments, and local providers that Housing First really is both housing and services. Next slide, please. The Housing Plus Act has two parts. The first part would prevent HUD from disfavoring certain service providers, including those that, quote, requires a condition of occupancy in a project that individuals meet certain prerequisites, such as sobriety or lack of drug use, unquote. Now that's clearly inconsistent with Housing First. Because HUD could not disfavor non-Housing First providers if the Housing Plus Act were enacted, HUD could arguably no longer promote Housing First in the COC scoring process. Next slide, please. The second part of the Housing Plus Act is a set-aside that requires not less than 30% of COC funds be used by recipients that, quote, provide or offer access to wraparound services, unquote. Now that language by itself would arguably not prevent HUD from using those funds on providers that follow a Housing First approach. However, we think the language will be revised to explicitly reserve COC funds for non-Housing First providers. Next slide, please. In fact, this has already happened. In May of 2022, Representative Barr offered an amendment to set aside 50% of COC funds for providers that, one, did not receive funds in the most recent COC competition, and two, imposed, quote, certain prerequisites, such as sobriety or lack of drug use, or engage in counseling, job training, addiction treatment, or mental or behavioral health services, unquote. And that second condition is clearly inconsistent with Housing First. I humbly apologize for the wordiness of that slide, but we'll be making all the slides available afterwards so you can review them at your leisure. Next slide. Oh, you're already there. Here are some arguments you might hear when educating lawmakers about housing first. I'm sure most, if not all of you, could better respond to these arguments. But since I'm seated in front of an open mic, I can't but offer a few remarks. The second point I think gives us a good opportunity to educate people about how housing first actually works, how the burden is on the case manager to be creative and persistent in engaging with clients who are not ready to accept services. I think argument number 3 allows us to remind people that housing first is an approach used on a housing program, which is why it's under HUD's jurisdiction. It's not a healthcare program, although the healthcare sector strongly supports housing first because it puts people in a better position to address their underlying health issues. Of course, millions of people have healthcare issues, mental illness, substance use, physical ailments, but they remain satisfactorily housed, even if they struggle with those issues most, if not all, of their lives. And having a healthcare issue should not disqualify people from living in homes of their own. Anti-faith, number 4. It just so happens that the Alliance is part of a large coalition of groups that lobby in support of Housing First, a group which includes Salvation Army, Catholic Charities, Evangelical Lutherans, and other faith-based groups. Other approaches, number 5, when pressed, the other approaches usually turn out to be allowing providers to discriminate against people based on certain prerequisites, like substance use. In other words, the failed approach Housing First replaced the approach that is not nearly as successful as Housing First in getting people housing. And given that homelessness resources are sufficient to help only a fraction of the people eligible, we need to use those resources on the approach that works best, Housing First. One size fits all, number 6. Oh, if I had a dime for every time I heard that, I could have retired long ago. Because the approach is client-centered, Housing First is anything but one size fits all. And nothing could be more one size fits all than automatically denying housing and services to people with acute needs like substance use, as we did before Housing First was adopted, and as we would do again if the Housing Plus Act were enacted. Sober lifestyle, number 7. Some congressional offices are new to homelessness. They think all homeless people are housed in one big building rather than being scattered around a community. Or they don't always realize that recovery housing is part of Housing First if it is chosen by the client. And then number 8, tough love. When I meet with congressional offices, I rarely miss reciting this factoid from a front page New York Times article. Quote, a 2022 study by the Los Angeles County Department of Public Health found that homeless people are 35 times as likely as the general population to die of a drug or alcohol overdose. They're also 4 times as likely to die of heart disease, 16 times as likely to die in a car crash, 14 times as likely to be murdered, and 8 times as likely to die of suicide, unquote. So getting people housed really is life or death. It's not a cliche. And there's nothing, quote unquote, loving about leaving people outside and denying them housing and services because they have acute needs. Next slide, please. If lawmakers want to show that they strongly support a bill, then they can become co-sponsors, by which they formally, a process by which they formally associate their names with the legislation. Generally, the more co-sponsors a bill has, the more support there is for that bill. You can see here that the Housing Plus Act is co-sponsored or strongly supported by 27 representatives. And by the way, it is possible to reverse the process. That is to say, a lawmaker can de-co-sponsor a bill. If you're going to educate lawmakers about Housing First, I seriously recommend checking first to see if they are co-sponsors of the Housing Plus Act, HR 3405. And 3 final points. First point, the Housing Plus Act does not address the much admired veteran homelessness programs that use Housing First, HUD-VASH, and support services for veterans' families. Obviously, enactment of the Housing Plus Act would be a terrible precedent for the veteran homelessness programs. In fact, some lawmakers who support the Housing Plus Act have criticized the use of Housing First in HUD-VASH. My second point is there is no Senate version of the Housing Plus Act yet, as of 4:03, August 14, 2023. But the other side is trying very hard to recruit a Senate champion. So please educate your senators about Housing First as well as your representatives. And now my third and final point. Congress is currently on its longest recess of the year, and many lawmakers are back home in their districts and states and meeting with their constituents. Excuse me, this is a great opportunity to meet with your members of Congress or their staffs and let them know how helpful Housing First has been to your community, how the approach has helped to get people off the streets, even people with the most acute needs and into permanent housing, about how Housing First has allowed your community to avoid many of the costs of homelessness associated with emergency health care, corrections, and law enforcement. As the shortage of affordable housing continues to drive up homelessness, the last thing we should do is downgrade or eliminate housing first, the most effective approach at getting people housed. Instead, we should be scaling up housing first so that more people eligible for homeless services can also benefit from the housing and services of Housing First. Homelessness may have become politicized in Washington, D.C., but together we can still remind members of Congress that the Housing First approach is effectively serving communities across the nation. And now back to our moderator, Nikki Dubois, for her closing comments.
Thank you, John. All right, I know we're a tad over time, so I'll make this quick. We heard a lot today about the need to better resource and scale up Housing First interventions. I encourage you to take a look at the resources put in the chat and reach out to panelists if you have further questions. Next up in our Housing First webinar series will be a webinar in September focusing on communicating the success of Housing First. It will feature Marisol Bello from the Housing Narrative Lab, Jennifer Rich from the Casemate, Mark Horvath of Invisible People, and moderation from the communications team at the Coalition and the Alliance. We hope you tune in. Lastly, a survey about this webinar series and today's webinar will pop up in your browsers at the very end. If you don't have time to complete it then, don't worry. You will also receive an email later with the same survey. You only have to fill it out once, but we do really hope that you fill that out and give us some feedback. Thank you so much to all of our wonderful presenters today, and thank you to all of you for tuning in. We really appreciate it and hope to see you next time.